No, unfortunately, surgery is the only way
To
that,
determine if you have it? You have to
yeah,
open yourself up just to see maybe I have this?
yes, a
How is that not
laparoscopic
visible on a
surgery.
CT scan or an MRI? Nothing?
No, no, because endometriosis can hide in so many different parts of the body that there really is only one way to test for it. And that was the only way that I could get the diagnosis is when I was having a planned surgery at the hospital. And they were able to do a biopsy and show me that I had endo.
Wow. Okay,
And I think
so
that's another reason why a lot of women are afraid to
yeah,
get tested for it because it's risky.
it's invasive. Yeah. So when you talk
Mm-hmm.
about shoulder pain, I'm curious if you can explain that a little bit more because I was with a group of ladies recently and I was talking about how when I reach to my nightstand, I get this pull across the top of my shoulder and that's never been there before. And they're like, "Oh, that's a sign of like perimenopause." I'm like, "Wait, what?" And so have you heard that before?
I have not, but it's possible
It's
that
they
that
call
is
it like
true.
frozen shoulder or something. And when you
Mhm.
just said that, I was like, wow, how would we ever compute that like a shoulder situation is tied to our fertility in some way or
Yeah,
female organs?
yeah. It's something that obviously made no sense to me when I was learning this from my incredible doctor Amanda Chu. Um, but if you're having the shoulder pain in addition to some of the other pains, it's something you should look into. Definitely don't want everyone who's having any type of shoulder pain to go and get this surgery and look for endo. But if you're having any of the other symptoms as well, I mean, irregular menstruals, heavier than usual periods, if you're finding that you need to change the products every couple of hours, like every 2 hours or every hour, that is not normal. So while I was always told every woman's menstrual experience is unique and some have easier periods and some don't, you're not supposed to have debilitating periods. It's just
Yeah.
no one is.
So back to the shoulder pain. What kind of pain did you have? What does that look like or feel like?
You know what? It was like a dull pain that made it really difficult to carry anything.
Okay.
So I was always like switching from shoulder to shoulder.
It was
Um,
uncomfortable.
it was very uncomfortable. Yeah.
Okay.
Are you
Just
getting
because I
scared?
know,